Hello viewers, welcome to another interesting episode of your health-friendly program, Health is Wealth on MCCP TV. I am Good Desuto, your host. As you all know, this program gives us insight on various health conditions affecting us and as well proffer possible preventions, management and treatment options. So keep watching Health is Wealth and remember to subscribe to our YouTube channel to get more interesting videos. Today we are talking about self-medication. Self-medication is a public health issue across the world which has caused several damages to lives. Self-medication simply means taking of drugs, herbs and other healing substances without consulting a medical practitioner. You know, in our society today, many people go on popping different types of pills into their body system without knowing the health consequences. Health is wealth. Self-medication is also a form of drug abuse. Some of these drugs include antibiotics, cough syrup, steroids and antihistamines, nicotine substances, pain relief medications such as tramadol, codeine, amongst others. To tell us more about the dangers of self-medication, we bring you this interview with a healthcare giver. Please pay attention. Health is wealth.
Yeah, I would say people do that because, first of all, the cost of healthcare is rising and is not meeting up with people's means, economic means. So take, for example, an average person, how much they earn and how much it will cost them when they go to hospitals to seek maybe care, for example. So the cost of healthcare is rising, which means that because of where we are in our system here in Nigeria, where people solely bear the cost of their care, there's no insurance, and also coupled with the fact that people's means of livelihood is not really, on the average, I'm just saying on the average. So that's why people resort to, going to the hospital will cost them money that they don't have. And because they don't want to die, they just, resort to going to the nearby patent medicine dealer to complain to the person. But meanwhile, that's very wrong. First of all, I would say it's wrong. It's wrong to do that, but people are doing it because of the rising cost of healthcare, one, and also because people's means of livelihood is not very good to meet up with these demands, and also because the system is designed in a way that people are left on their own. For example, in developed countries where I trained, healthcare, for example, in the UK, the government takes care of healthcare. You just pay your tax and they take the money from there. NHS takes care of you when you're sick. In the US, you buy insurance. They have even what they call copay, and they even have insurance for poor people. And rich people as well have their own means, they can buy their own insurance. So, but here in Nigeria, is not like that. People are left on their own to pay for their bills, when they are sick. Do you get? So I think that's why people self-medicate, and the effect is that the life expectancy in Nigeria is very low, mostly because of this. Not even because our hospitals are not equipped or we don't have enough medical manpower. No, it's because of self-medication. Let me explain this. Let's say someone that is having headache, for example, or even a tummy ache. They don't know why they have a tummy ache, for example. So they go and buy stuff. Let's say someone that has intestinal obstruction, for example, vomiting and is having stomach ache, and goes to buy a medication. That medication can even make the problem worse. And people will only resort to come to the hospital when they don't have any other option than, that's when they come. And by that time, you see that the time, because healthcare is very, very complicated in such a way that the window to save somebody that is sick most times is not very broad. It might take maybe a few days to even a few hours to even a few minutes. So when most times patients present when they are even almost dying, it becomes more difficult to save them. So that's why. So, and also, it makes it paints a bad picture of the health sector in Nigeria in general, because when people present late and they don't get good outcomes, they will say the health system in Nigeria is not so good. Do you get? Yeah. So, but the sicknesses and diseases that could have been easily fixed just by just visiting, going for just consultation and then getting a good diagnosis and early diagnosis. So take, for example, someone that is developing diabetes and having symptoms that they don't understand, and they continue to, buy this and buy that and take this and take that, will even make the problem more complicated. Do you get? So by the time they even resort to coming, the disease is probably advanced, and sometimes, most times, they don't even come. They even die before they come. Yeah, my advice to people that indulge in self-medication is, I'll tell you, it's not good. Sorry, it's very bad. You're not doing yourself any good. I'll suggest that you go and get a health insurance. Find any health insurance scheme available around where you're living and buy it, so that it will be easy for you to access healthcare when you need it. There are some medications that are addictive. You start abusing them. Before you know it, you become addicted to these medications. And before you know it, it becomes a problem for you. I mean, there are medications that cause a lot of, that medications are potential poison. So you can, even paracetamol, there's a quantity of paracetamol you can take that it will become a poison. It will poison you and you'll die. So, I mean, so many people have died because of self-medication.
Health is wealth. Welcome back, viewers. You're still watching Health is Wealth. From our findings, the most effective way to reduce the level of self-medication is by creating awareness programs, because so many people are not even aware of the dangers of self-medication. That is why we at MCCP TV made this video to help our viewers understand the dangers of self-medication and the way forward. The way forward here is say no to self-medication and always go for medical diagnosis. And to do further justice to this topic, let's find out how often people self-medicate and why. Health is wealth.
Self-medication is when you medicate yourself. That is, you buy drugs by yourself. You determine what you think works for you. You are feeling sick, and then you just think about, because you saw someone that had a particular sickness and the person used this particular drugs, so you think because you have the similar sickness, so that similar drug will also work for you, and you just go ahead and buy without the doctor's prescription.
I feel the problem with self-medication is that it cannot be controlled. You cannot really limit. You can ask someone to get paracetamol, and you can get more than you want him to get, or probably I want to get malaria drug, but I get the one that is not really good for my body.
The reason I self-medicate most of the time, because maybe I am far from the hospital, or I don't have the finances to get to the hospital at that moment, so I take paracetamol, but not take a drug that is not prescribed to me by a professional. The highest I can do is take paracetamol.
Health is wealth. Abuse of drugs can also trigger more sicknesses or even worsen your symptoms. You will see yourself advancing from one illness to another. Self-medication kills our immune system. Our immunity becomes low and unable to fight germs. So here comes the end of this episode. Please remember to share this video, like and leave a comment below. Subscribe to our YouTube channel and hit the notification bell to get notified on our next video. I am Goodness Uto. Please stay healthy and bye for now.